If your doctor has been unable to resolve your or your loved one's condition, please leave us a comment with a brief description. We will get back to you with current research information. Airplane ear means injury to your body because of changes in air or water pressure. Another name is barotrauma. One common type happens to your ear. A change in altitude may cause your ears to hurt. This can happen if you are flying in an airplane, driving in the mountains, or scuba diving. Divers can also get decompression sickness, which affects the whole body. Common symptoms of ear barotrauma include pain, a feeling that your ears are stuffed, hearing loss, and dizziness. Treatments for ear barotrauma include chewing gum and yawning to relieve the pressure. Medications such as decongestants may also help. Causes: airplane ear occurs when the air pressure in the middle ear and the air pressure in the environment don't match, preventing your eardrum from vibrating normally. A narrow passage, called the eustachian tube, which is connected to the middle ear, regulates air pressure. When an airplane climbs or descends, the air pressure changes rapidly. The eustachian tube often can't react fast enough, which causes the symptoms of airplane ear. Swallowing or yawning opens the eustachian tube and allows the middle ear to get more air, equalizing the air pressure. Ear barotrauma can also be caused by scuba diving, hyperbaric oxygen chambers, and explosions nearby, such as in a war zone. You may also experience a minor case of barotrauma while riding an elevator in a tall building or driving in the mountains. Prevention: follow these tips to avoid airplane ear. Yawn and swallow during ascent and descent. These activate the muscles that open your eustachian tubes. You can suck on candy or chew gum to help you swallow. Use the Valsalva maneuver during ascent and descent. Gently blow, as if blowing your nose, while pinching your nostrils and keeping your mouth closed. Repeat several times, especially during descent, to equalize the pressure between your ears and the airplane cabin. Don't sleep during takeoffs and landings. If you're awake during ascents and descents, you can do the necessary self-care techniques when you feel pressure in your ears. Reconsider travel plans. If possible, don't fly when you have a cold, a sinus infection, nasal congestion, or an ear infection. If you've recently had ear surgery, talk to your doctor about when it's safe to travel. Use an over-the-counter nasal spray. If you have nasal congestion, use a nasal spray about 30 minutes to an hour before takeoff and landing. Avoid overuse, however, because nasal sprays taken over 3 to 4 days can increase congestion. Use decongestant pills cautiously. Decongestants taken by mouth might help if taken 30 minutes to an hour before an airplane flight. However, if you have heart disease, a heart rhythm disorder, or high blood pressure, or you're pregnant, avoid taking an oral decongestant. Take allergy medication. If you have allergies, take your medication about an hour before your flight. And try filtered earplugs. These earplugs slowly equalize the pressure against your eardrum during ascents and descents. You can purchase these at drugstores, airport gift shops, or a hearing clinic. However, you'll still need to yawn and swallow to relieve pressure. If you're prone to severe airplane ear and must fly often, or if you're having hyperbaric oxygen therapy to heal wounds, your doctor might surgically place tubes in your eardrums to aid fluid drainage. Ventilate your middle ear and equalize the pressure between your outer ear and middle ear. We hope you have found this information valuable. If you enjoy these videos and want to support us being able to continue creating content for many years to come, we'd love for you to consider becoming a patron of Converged Medical Research. The link for becoming a patron is in the description below. We have many other sessions on medical-related topics coming. If you need information on a particular topic, please leave a comment below. Please click the subscribe button and ring the bell.